Hi guys, how are you? This is another topic coming to you on Sunday. I hope you guys are doing well. I hope you're having a great week. The topic today is varicose veins. There are people who get varicose veins, and I thought it would be interesting to touch a little bit on what varicose veins are. Pretty much, varicose veins are twisted, enlarged veins, and most commonly occur in the legs because of pressure, standing all day, walking. This increases the pressure and the veins of the lower body, and that's why for most people varicose veins are in the lower extremities meaning legs for most people. Some people have spider veins are a lot less in size than varicose veins. Varicose veins are like tight bands under the skin that are visible to the eye, while spider veins are thin lines that you can see under, but they are not twisted or anything. Risk factors is weight, prolonged standing. For some people, they cause pain. They cause pain in some people that some people decide to go for surgery, but it is pretty much a twisted, enlarged vein that is visible under the skin. Sometimes they can lead to more serious problems, but mostly it's discomfort. The patients will complain of having severe discomfort from the varicose veins. When you have varicose veins, what are your symptoms? You have dark purple blue lines under the skin that are visible to the naked eye, an achy feeling in your legs. Some people report that they have burning, throbbing, muscle cramping, and swelling in lower legs because of this varicose veins. Veins that appear twisted, as we had talked about, and bulging in the lower extremities. Most of the time, it's in the legs. That's why I keep saying lower extremities. Itching around one or more of the veins is a common symptom. Changes in skin color. So you'll notice, like in Caucasians, the skin is white, but underneath you see purple-like veins that are twisted. Those are the varicose veins. The spider veins are thin lines that you can see under the skin, but varicose veins are a lot bigger than the spider veins. Some people decide to take them out. It's considered cosmetic, but some people, the pain is so bad that they are okay with, taking it out, especially when it causes that heaviness of, feeling in your legs. Some people get night cramps from having varicose veins, itching the legs because of varicose veins, aching pain in the legs because of varicose veins. And you may ask, so how do I know if I have varicose veins? Most likely you'll go to your primary doctor, they'll have a look at you, they'll do a physical exam, and they'll be able to tell you that you do have varicose veins. Most of them are visual. If they're not visual, they can do an ultrasound or an x-ray. But for most people, the really severe ones, you don't need an ultrasound or x-ray. You can look at their lower extremities and notice that they do have varicose veins. Most people ask, so what causes them? It's pretty much weak or damaged vein walls and valves that cause varicose veins. We have one-way valves inside that open and close to keep the blood flowing toward the heart. And then the weak or damaged valves or walls in the veins can cause blood to pull, even flow backwards. That is called reflux. The veins will grow larger and become distorted, resulting in varicose veins. That's where it comes from mainly. So it can be so severe, very uncomfortable, that some people will seek to have surgery done. There's surgery that you can do to the varicose veins. There are a few procedures that we do. I'm familiar with one of them. Depending on how serious your symptoms are, they may consider doing surgery. Recommend a combination of treatments or go straight to surgery, but mostly they'll recommend a combination of treatments so that they see if you can avoid surgery. But some people, it is so severe that eventually they end up having the surgery. There's also a chance that after surgery, you will develop new varicose veins, and the and the veins continue to grow enlarged, and then you still have them. So that's a possibility, though most people at the point where the pain is so bad, they decide to take a chance and say, you know what, let's have surgery. So you may be treated more than once. It's not unusual to be treated more than once for the varicose veins. The goal of treatment is to relieve the symptoms, improve appearance. For some people it's cosmetic, so the very torturous big ones are big. When you look at them, they're really big, so it improves the appearance of that. You can get skin ulcers from them or sores after they do the surgery, but at the time people decide to do the surgery, at that point that is not their concern. They just want to have relief from the pain of these varicose veins. You can try to do some lifestyle changes, being physically active if it helps. Some people, they do report that they decided to start walking and exercising, and that helped decrease their symptoms. And then the other thing is, if you're overweight and you try and lose weight, usually that will improve the blood flow and decrease the pressure in your veins. So that's another way you can do it. Aim for a healthy weight, decrease the pressure in your veins, being physically active. This will help the blood move through the veins. Strenuous or vigorous exercise may make varicose veins worse. So do one that you can tolerate and that your body can tolerate, and that will not worsen the pain of the varicose veins. Whatever exercise you do before starting an exercise program, check with your doctor and see if that it's okay for you to be able to exercise and what level of physical activity you can do. Another thing is, avoid standing or sitting for prolonged periods of time. I notice most of the people who have varicose veins use TED hose. These are tight socks that go around the lower extremities, and this helps the pressure, which in turn helps decrease the pain. So avoid standing or sitting for prolonged periods of time if you do have varicose veins. This usually helps. So they have a few procedures that they can do. The one I'm familiar with that a patient actually told me was super painful was sclerotherapy. I had a friend do this, and she said it was super uncomfortable. They inject a liquid or foam chemical into the vein to seal it closed. And then this is usually done under ultrasound guidance in your doctor's office. It's used for, the liquid sclerotherapy is used for spider veins. It can cause an embolism, what we call a blood clot or nerve damage. So they can be severely painful, sometimes a serious allergic reaction, but they would have checked your allergies prior to doing this. So headaches, confusion can come from this, being injected this liquid form of chemical to seal the vein. It does help if it works, but it's very super painful. So if you can go through that. Another thing they do is endovenous ablation to close off the varicose vein. They can do that for you. You go in, your doctor uses laser or radio frequency energy to hit the inside of the vein and close it. That's uncomfortable, but it works amazing. Very uncomfortable, very painful, but the people who have the procedure are glad that they had the procedure. It's usually done in your doctor's office with an ultrasound guided treatment. That's how they do it. Your area is numbed first before they go ahead and inject the vein. So they will numb it and then go ahead and use laser. Laser can be painful, so I can't imagine laser on varicose veins, but that's the endovenous ablation that they do in your doctor's office. So you do not feel pain during the procedure because they've given you anesthesia. It is after the procedure that most people report the pain. You have bruising, you have pain, and then changes in skin color because of the laser and the numbing medicine. So you may have those, but some people are willing to take that chance just because the varicose veins are painful and annoying to them. So they are willing to take the chance and have the endovenous ablation done. Other serious complications that could happen with that is numbness and having a blood clot. Skin burns are rare, but numbness and having a blood clot can happen to you. Another third one that they do is surgery to remove the varicose veins. This is usually last chance, last option, but there are people who opt for it. So they can do surgery to remove the varicose veins. You'll have small cuts to remove the smaller varicose veins near the skin surface. And then for the larger varicose veins, the doctor may use a tool to tie off and remove them in a procedure called vein ligation or stripping. Painful from patients who've had this. So most of the time, these surgeries can be done outpatient, and in the evening you go home, pretty manageable. But it is the pain afterwards, because during the procedures you're usually numb and you don't feel it, but afterwards you do feel the pain. So those are varicose veins. They can be bothersome to some people. Some people, it's more the cosmetic. They don't look good. I want to get rid of them. But some people, it is the symptoms that are painful, achy feeling when you're standing and stuff, and they just want to get rid of them. You can get infection. You can get nerve damage, bruising, pain, changes in skin color from all the above that I mentioned. The ablation, sclerotherapy, and then surgery to remove the varicose veins. So in a nutshell, that is what your varicose veins are. When you leave and you're healed, they recommend that you use compression therapy. Compression therapy meaning you can use TED hose. After it's healed, the pain has gone away, then you can put on TED hose. And TED hose are these tight socks that some people use when they're traveling. They will ask you to buy those for your compression therapy. After you have the procedures that I had mentioned above, after you have that done, you can use that compression therapy. You can get them in medical store. You can get them on Amazon. Amazon does have them, and you put them on. This helps tighten the area so that the pressure is not so bad, and that in turn decreases the pain. So it's good to get those. You'll be told how long you can wear them. Usually most of the time you're standing, you're required to put on those compression stockings. It helps relieve the swelling. It helps relieve the pain. It helps relieve that feeling of heaviness in the leg. So compression therapy relieves symptoms. You can use it before surgery or after surgery, or if you're not intending to have surgery and you want to help with the varicose veins, it helps. It relieves the pain. It relieves that heaviness that you feel in your legs. So compression therapy you can use after the procedure or before the procedure, or just trying to control the symptoms on your own. After you have the procedure to remove your varicose veins, most doctors recommend you put on compression stockings for at least a week after the procedure. This helps with pain, as much as it's painful pulling them over the surgical sites, but it helps keep them in place and then decreases your pain, as I talked about. Medicines, you may need to take like regular over-the-counter pain medicines to help relieve the pain after the procedures have been done. They do have a medication that is approved just for varicose veins. If you're using regular pain medication, it's like Tylenol, ibuprofen, but you check with your doctor which one you're okay to use. But there's only one medication that is approved for varicose veins, and it's called Diosimplex. That's the only medicine approved for varicose vein treatment. It's a plant-based medicine which will help with some varicose vein symptoms and complications, including swelling, ulcers, and changes in skin and tissue of the legs. So that's the only one. You may not notice a difference immediately. Once you take the medication, you may have to wait a long time to see the difference. So it's not one that you take and you notice the difference immediately. So give it time. It's the only one that's approved. Give it time and see if it helps with your symptoms. Risk factors for varicose veins: aging. It causes wear and tear on our valves that help control blood flow. So that's one of the risk factors. Another one, sex. Women are more likely to get varicose veins than men. It's because of our hormonal changes. It may be a factor to why we are more prone to get them than men, or hormone treatments such as birth control. It may increase the risk of varicose veins. Pregnancy in some people increases the risk of varicose veins. So they don't have varicose veins, but once they get pregnant, they do get the varicose veins. So I think it's attributed because of the increased blood flow. So there's increased blood flow, and that it's to support the growing baby, and that's how we get the varicose veins. Some people get it because of family history. If other family members have varicose veins, there's a greater chance that you as a family member will also get varicose veins. And then being overweight, as I had talked about, is a risk factor, and sitting and standing for a long time, which most people do. So those are the main risk factors for it. We talked about complications, so I'm not going to repeat that. Prevention. There is a way you can prevent it. Improve blood flow and muscle tone. It will reduce the risk of developing varicose veins. Avoid high heels and tight hosiery. That is a risk factor. If you avoid that, then you're preventing it. Change your sitting or standing positions regularly. Don't stand for prolonged times, because that is a risk factor for varicose veins. Eating a high fiber, low salt diet. Exercising, as always, is a prevention mechanism. Raising your legs when you're sitting down and watching your weight. So those are prevention. So I'll go over the prevention again. Avoid high heels and tight hosiery. Eat a high fiber, low salt diet. Exercise. Watch your weight. Raise your legs when you're sitting or laying down, and then change standing or sitting position frequently so that you're not in the same position for a long time. So that is the main things I can think about. Healthcare provider is able to tell you. Some people will do the test, but most varicose veins, you can have a look at them and see what it is. Talk to your doctor. Talk to your doctor. If they bother you and you need surgery, talk to your doctor. They do vein stripping too. I forgot to mention that. They do vein stripping. That's a painful one. So they tie off, what the vein stripping is, they tie off a vein before it joins a deep vein, and removing the vein through small cuts. That is painful. I don't know that there's any varicose vein treatment that is less painful, but the vein stripping one is super painful. Removing the vein won't keep blood from flowing in the legs, because veins deeper in the leg take care of larger volumes of blood, so that won't prevent it. And then ambulatory phlebectomy, where a healthcare provider goes in, removes the smaller varicose veins through a series of tiny skin punctures. Only the parts of the leg that are being picked are numbed in this outpatient procedure, and then scarring is generally minimal. So there are many choices that you can choose from. If it bothers you so much, you have ambulatory phlebectomy to choose from, vein stripping, sclerotherapy, ablation, laser treatment. It is you and your provider discuss what works best for you. If it is bothersome enough that you need to do a procedure, sit down with them, go through the pros and cons of each procedure and see which one works for you, or which one you as a patient can tolerate, and then you can decide with your primary care which one to go for. But otherwise, after the procedures, compression stockings, you can do the compression stockings before or after the procedures. It doesn't matter. The compression stockings always help relieve off that pressure from your lower extremities. So that's a basic on varicose veins. You guys have a great week. We'll see you next time. Bye-bye.